Hello, I'm Dr. Brandon Menke, one of the comprehensive ophthalmologists and partners at ilumin, and I'll be talking about oculoplastic surgery, namely blepharoplasty, ptosis repair, and brow lifts. One of the main reasons that patients get sent to me for oculoplastic surgery they typically fall into one of three categories: having brow ptosis, or when the eyebrows droop; ptosis, which is when the eyes droop; or dermatochalasis, which is when there's redundant tissue on the eyelids that typically overflows over the margin of the eyelid, obstructing typically peripheral vision. This is a very common manifestation, typically worse with aging, and something that can be corrected with surgery. Dermatochalasis, again, is the redundancy of skin in the eyelids. What happens is that skin can overflow over top of the margin of the eyelid, obstructing the peripheral vision. This again is associated with aging and is treated surgically by a procedure called the blepharoplasty. A blepharoplasty is typically performed in the surgery center, where the redundant skin is then marked out using a skin pinch technique, and then the skin is removed and then stitched up. As far as the procedure goes, it's fairly minimally risky. However, infection and bleeding would be the most common risks. Ptosis, or the drooping of lids, is another very common procedure that I perform to correct the ptosis. There are two different surgeries that I perform. One is called a muellerectomy, which is removal of tissue on the inside of the lid, and also something called an external levator advancement, which is through the front of the lid. Typically, patients with mild to moderate ptosis, or again, the drooping of lids, can have successful lifting of the lids with good cosmesis using a muellerectomy, again, removal of skin on the inside of the lid. An external levator advancement is a procedure going through the front of the lid, typically reserved for patients with severe ptosis, so much so that vision is almost completely obstructed. Both of these problems, both dermatochalasis and ptosis, are very easily corrected through surgery. It's a very rewarding experience to have patients that, again, think that their vision has been obstructed because of something that cannot be fixed. However, it is very easily managed and, again, can improve the field of vision of patients, not necessarily the center vision, however, can improve the field of vision, the brightness, and the quality of life for these patients.